The government is continuing its vaccination program against the still persistent COVID-19 threat, but now with more emphasis on providing bivalent vaccines. No less than the president led the kickoff of the government's bivalent vax program to ensure continued protection against the once global menace. Mark Fatalco tells us more.
Let this occasion serve as a call to every Filipino to continue doing your part, get updated on your COVID-19 vaccination to prevent the resurgence as a means of honoring those who sacrificed their lives during the pandemic.
President Ferdinand R. Marcos Jr. said this during the launching of bivalent COVID-19 vaccination at the Philippine Heart Center. The president asserted that COVID-19 vaccination should continue despite the improving COVID situation in the country.
We must not let our guard down. Although the rest of society, the other sectors of our society that have tried to move on and say the emergency is over. And certainly, in a way, we can say that is the case. However, it is not over completely.
Among the priorities for the bivalent vaccines are the elderly, who are the most vulnerable to COVID-19 and its variants like Omicron.
These new variants force us to once again re-examine what it is that we can do to help protect our populace. And that is why we are now here today to highlight this extremely important program, once again, vaccination program, which we are going to have to institute.
The president recognized the sacrifices of healthcare workers who saved the lives of millions of Filipinos at the height of the pandemic. He also thanked the WHO and the COVAX for their continuing support to the country. The Philippines earlier received the 390,000 doses of bivalent vaccines from Lithuania. The DOH has already distributed these vaccines to different regions, including the NCR, with an allocation of 108,000 doses. Health Secretary Ted Herbosa received this bivalent vaccine, making him one of the first recipients in the NCR. Herbosa said his blood pressure went up after the vaccination. The health chief explained that bivalent vaccines provide protection against the original COVID-19 strain and Omicron subvariants, including the newly detected FE.1.
Generally, because this is still Omicron, and nilagay na yung Omicron dun sa bivalent vaccine, mayroon namang cross-immunity yan. Kasi yung mga antigens pareho lang, even if it's a different subvariant. At hindi maihinto yan. Palit ng palit yung subvariants niyan.
Herbosa said negotiations between the Philippine government and COVAX are ongoing for around 2 million COVID bivalent vaccines. For now, due to limited supply, only the A1 or healthcare workers and A2 or the elderly will be allowed to receive a third booster shot.
Alam natin ang COVID-19 kills the elderly, so talagang priority natin ang senior citizens. Pangalawa, we all know our healthcare workers are exposed kasi sila yung humaharap dun sa bagong variants, di ba? Pag na-hospital yan, sila ang exposed. So we don't want also mabawasan tayo ng healthcare workers.
One of those who lined up early for the bivalent vaccine was Medtech Yulilin, who is exposed as a healthcare worker.
3 years na po since yung nagka-COVID, and first time ko pong magka-COVID nung April. So ayoko na po sanang maulit. So nag-decide po ako na magpa-take pa ng isang vaccine po, no, yung bivalent po, para hindi na po sana maulit yung nag-positive ako.
Mark Fatalco for The Nation.